All right, this is what a bulging disc looks like. Now that one would be pretty severe, but if you see, this is the spinal nerve. This is an example of vertebra in your spine. These are called the vertebral bodies. This is the disc. These are the structures in the back. Those are the bumps you feel when you rub your hand along your back. These are called transverse processes, and they're where we attach certain muscles to and ligaments and tendons. And the spinal cord runs down the hole in the middle, and then you have nerves that come off. And those nerves are the nerves, if you're talking about a bulging disc in your arms, those nerves would run down your arms, and then you might get a numbness and tingling in your arms or hands, or pain in your neck, or pain in your shoulder, or pain in down your arm. You get the idea. If they go down your legs, we're talking about situations regarding the legs. Now, if we get a bulging disc, you can see how that would push on the nerve. It might even push on the spinal cord itself. So is the solution to that to go cut off that portion of the disc? Is that the solution? Well, I would argue that it's not. And the reason is, in most cases, that's not the best way to do it, because the reason the disc bulges in the first place is because it gets weak. It gets weak because it gets dehydrated and the tissues start to die. It can be dehydrated because you're not consuming enough water, fluids, but the most common reason it gets dehydrated is because the bones do not move properly. We don't have enough motion in the joint itself. I'm not saying the person can't bend over and touch their toes, but not enough motion in the joint itself to keep the pumping action of nutrients into the disc and out of the disc, all right? And fluids and toxins out of the disc. So nutrients in, toxins out. And that happens through motion only. So if we have an area of your spine, a disc or two, a vertebra or two that do not move, almost always that's going to be the disc that's deteriorated. Almost always that's going to be the disc that is bulging, and it's going to be the disc that's giving you a problem. Anywhere we do surgery, we're going to create more scar tissue and more adhesions, which is going to limit motion even further, which is why it is the fundamental reason why there are so many failed back surgeries, because we get scar tissue and adhesions around the tissues that either make that single area, the problem, come back again, or the area above or below it also then deteriorate and become an issue. That's why 50% or more of surgeries in the back are considered failed back surgeries. Then we're talking about, I had a neurosurgeon tell me that's just what's published. It can be even higher than that, maybe even 75% of back surgeries are considered failed surgeries. So what do you do about it? Well, decompression therapy is a great way. Spinal manipulation from an osteopath or a chiropractor, or even physical therapy, can improve the motion of the joint, thereby getting your body more able to get nutrients into that disc. And there are lots of other modalities somebody can use too. Shockwave therapy to break up adhesion, pulsed electromagnetic field therapy. There can be other injections, not steroids. Steroids breaks down the tissue. There's lots somebody could do. Stem cell therapy, platelet-rich plasma, lots of things you could do before you opt to have a surgery. Anyway, I'm Dr. 𝗕𝗰𝘁 at Magnolia Medical Center here in Murfreesboro, Tennessee. I hope you found this informative. Hit the like button, hit the share button, and hit the follow button. Take care today.